Good morning, Chicago. I'm Dr. Allison Iwerty, Commissioner at the Chicago Department of Public Health. Today is Tuesday, February 2, 2021, and we are back to answer your questions related to Chicago's COVID situation. We'll be talking a lot about vaccine today, again, I'm sure. And as always, you can put your questions directly into the box below on Facebook. You can also use the hashtag AskDrArwity on either Facebook or Twitter, and we'll be taking those questions live. If we don't get to them live, do put them in because we're updating our website every single day with much more information. So as a reminder, always chicago.gov/coronavirus is your one-stop shop for everything related to COVID. If you specifically want to get to the part about vaccine, you can also get there directly, chi.gov/COVIDVAX, VAX, but it's also the vaccine tab off the main page. So let's start with our data dashboard. Let's get that up. Yep, okay, so as you can see, really good progress here in terms of continued improvement in our COVID numbers and our COVID positivity. So first, you can see we are now at a 5.6% test positivity here in Chicago. A week ago, we were at 6.9, and you can see in this purple graph, we are getting so close to that target positivity of less than 5%, which is where we really want to be ideally, where we were over the summer. So that has been really nice progress. Our testing numbers continue to look good in the 12 to 13,000 range. And then our case number is also below 600. We're averaging 577 per day. You can see a week ago that we were at 705, down 18%. And this, both our positivity and our daily case rate are the best that they've been in 4 months. They're equivalent to where we were back October 12 and 13. And really a testament to people being careful, wearing their masks, doing the social distancing, not gathering unnecessarily, and I really want to thank everybody for that work that we've been doing. Also, you can explore some more, but deaths are also under 10 a day. We're at 9 deaths per day on average, down from 24 per day at the height of the second peak, and almost 50 a day was the worst we'd seen here at the beginning of the first, or in the first peak in the spring. So everything heading the right direction. I also want to actually pull up some vaccine data, and as you know, this is all available online, but we have a press conference later this afternoon at 1 o'clock, and we will be making some announcements related to some technology and sign up that you'll potentially want to tune in for, and giving some updates related to vaccine. But I was going to give you a little bit of a preview on some of the data here, and we'll be posting this online in the context of the press conference. But just to kind of highlight, so this is the graph that you can also see online. We're up to 1 in 18 Chicago residents that have gotten at least a first dose of vaccine. And if we drill down even further on that, it's 1 in 14 Chicago residents, if we just take people who are over 18, who of course are the ones primarily eligible for the vaccine. And the good news is we're actually at 1 in 8 Chicago residents who are age 65 or older have gotten at least that first dose of vaccine. We've seen really nice improvements from that. Also, as you've heard me say, our goal is to make sure that we are pushing out at least 95% of the allocated doses that we get here in Chicago, pushing that out to providers every week. And so you can see in the gray here, that's the amount that's allocated, and then the red line is how much we get pushed out. And we've been doing very well with this. We're at 99% of the doses that are allocated being pushed out to providers. And so that means we're not leaving any vaccine sort of sitting in the federal allocation. We're not leaving vaccine in the warehouse. All of these doses are sent to providers or already allocated for appointments that are scheduled in our City of Chicago pods and strike teams. So that's been going well. And then related to the administration doses. So in green here, you see well, let me take one step back. We've pulled out here the data for our long-term care facility program. There's a federal long-term care facility program that we had to set aside all of the doses that would be required to give everybody in long-term care facilities, every licensed bed, every staff member, first and second doses. Those doses, though, get administered, beginning in late December and going all the way through March. And so there's been about 117,800 doses that had to be set aside for that program. And pulling that out, because those aren't otherwise available for use in other settings, the green line here shows you the vaccine doses that have been delivered, and then we basically, with the blue line, look 7 days later. We really want to get to a point where at least 85% of our vaccine is administered and in arms, and then being reported within 7 days. Ideally, we want to get that to 100%, but in terms of what we look at for our providers, in terms of how we allocate additional vaccine, our goal is to make sure that that's at least 85% of the doses in arms and reported. And a lot of where there's a lag here is still where, as we've been bringing on many more providers, especially as we've moved into 1B, there are still a number of cases where people are putting vaccine in arms, but then the data is still not always fully coming through on the individual level. And so we're doing a lot of quality control there. But the bottom line is 78% of our vaccine doses have been administered and reported within 7 days of delivery. And that's pretty good. We are not where we want to be yet. We want to be over 85%, but every week the team is working on this, and generally that's where we are. Also, just quickly, here's just highlighting graphically our senior population. So you can see in the black arrow, the first black arrow is where that long-term care pharmacy partnership program started. So in green are people 60 to 69, pink are 70 to 79, and then blue are 80 plus. And so that long-term care pharmacy program started, and you can see some increase there. But then beginning on the 18th, when providers could start administering excess supply to people who were over 65, and then particularly when we started in phase 1B, as expected, we saw big increases, as this opened to this group. So we've been really pleased to see that. And in that setting, I said 1 in 8 Chicago residents, and you can see just week over week, we saw in people 60 to 69, that coverage go up by more than 5%. In 70 to 79, more than 9%, and 80 plus, also about 9%. So very pleased that the vaccine is getting where we need it to, and these are Chicago residents. So we've talked about how we are doing a lot of vaccinating of non-Chicago residents, especially if they work in Chicago. But this is specific to Chicago residents. So pleased about that. And then finally, some of our race ethnicity data here. So, as we reported when we announced our Protect Chicago Plus initiative, which is really working to push vaccine into the community areas that are most vulnerable to COVID, we highlighted that when we launched this just a week ago, I think it was a week ago, we were at 1 in 45 Latinx Chicagoans had gotten that first dose, 1 in 53 Black Chicagoans, and really just with that first week over 1B, we've seen big improvements there. 1 in 30 Latinx has now gotten the first dose, 1 in 31 Black non-Latinx. We still have a long way to go. If you compare that to 1 in 14 white non-Latinx Chicagoans and 1 in 13 Asian non-Latinx Chicagoans. So a long way to go still in terms of equity, but pleased to see those good increases. And even over that 1 week, we went from 17% to almost 20% of those first doses going to Latinx, and from 15% to 19% going to Black non-Latinx. So the team's following this data closely and really continuing to work on strategies, but very pleased to see some good improvement there already as we move from 1A to 1B, and we're not only focused on the healthcare workers. So long way to go, but some nice progress even in 1 week. This just highlights our provider enrollment. You can see on this map, and again, we'll post this so you'll be able to look. This just highlights all over the city. Those purple dots are our federally qualified health centers. There's more than 100 of those. The blue are the hospitals, 34 of those. The green are pharmacies, and the turquoise are outpatient clinics, and you can look further from there. The team's been working hard to really work on recruiting and enrolling providers, particularly in our higher vulnerability, higher COVID vulnerability communities. And this is what that distribution looks like. And then as we've been moving on, what you see here in dark blue is the hospitals. And you can see early on our hospitals were administering 84, 87% even of the doses in Chicago. And that's because we were very focused on healthcare workers and their own employees. But as we moved on, you can see moving to the right there, we're starting to have more in the federally qualified health center, the outpatient, the pharmacy, and the public health space. And so that has been good because it's helped us really build a network of providers that can receive this vaccine and then be able to distribute it. This just highlights our long-term care pharmacy partnership. We have had first clinics at 77 of our 78 skilled nursing facilities, so that's going well. The yellow here highlights second visits that are scheduled, so we're just starting to get some of those second doses in. We are hoping to see even better uptake than we've seen to date, and following that closely. And then this is just highlighting, we'll post it online, but how much of the different vaccine we've been receiving. This week, next week, the week after, we continue to expect to receive 17,550 first doses of Pfizer, 22,400 first doses of Moderna. That means broadly, Chicago is getting a little bit less than 40,000 doses of vaccine, first doses of vaccine every week, which means we're able to start vaccinating 7,500 people across the whole city every day. Reminder, there's more than 360,000 people over 65 who live in Chicago. There's 350,000 frontline essential workers, not even including the ones who are eligible in 1A. So we're getting enough vaccine to vaccinate not even 5% of the people who are eligible, but we're making good progress. So we will post this. You'll have the opportunity to explore it yourself, but I know a lot of you have been sending in questions around that. And with that, let's actually turn to questions. Okay. Rachel Edwards on Facebook. There are several folks living in tents in my community. I'm not sure if they go to the shelters. Is someone getting vaccine to those people as well? Yes. So remember, one of the things that the Chicago Department of Public Health has been doing is making sure we are pushing vaccine to some of our very highest risk settings for COVID. And homeless shelters are absolutely one of those groups. So we have had strike teams. We've been partnering with Lawndale Christian Health, with others, who have been ongoing partners to us in terms of getting more care into shelters throughout COVID, something that we want to really make sure outlives COVID. Bringing vaccine in, very good uptake, I will say, in these shelters. People excited to get vaccine, happy that these settings are prioritized, and we're happy because every vaccine we get into a high-risk setting makes us not be as concerned about needing to push a lot of testing and intervention resources there. So we're focused right now on getting through shelters, but we do have plans to do outreach to some of the small communities of people who are, living in tents, may not be going into shelters. And we're working with some of our partners who do homeless outreach for planning around that. So that is a priority population for us, certainly here in 1B. And again, it's been really, I love seeing the pictures and the, why I get vaccinated posts. And I've been especially pleased to see that out of people who are, from people who are unstable housed, and just having a hard time of it right now. Being able to make sure that population can get vaccinated is good for them and good for Chicago. Denise Conroy on Facebook. Wright College is part of Chicago colleges, so why was that left out? Oh, yeah, it hasn't been left out. Wright College is actually coming online, I believe, this week in terms of a City of Chicago point of dispensing. So as a reminder, we are at, I believe, 7 city colleges now in terms of these larger vaccination sites. Now, to be clear, we are still doing a lot of 1A healthcare workers, but we have started to be able to open that up. So we've been able to be pulling in some first responders and others. And then later this afternoon at the press conference, we'll be announcing some more information about some technology that will overlay appointment availability at some of those point of dispensing sites, probably a little bit further down the line. So Wright College is absolutely in there, and I believe they have their first clinic even going this week. We'll if you look online, you'll be able to see the details, and we'll share some more about that. But also, let me just take this moment to remind people, every vaccination in phase 1B is by appointment. You cannot show up at Wright College. You cannot show up at any of the other points of dispensing. You can't show up at a pharmacy, at a clinic. You need to have that appointment. And again, the way most people are getting vaccinated, these good increases in the 65 plus, et cetera, most of those are coming from our healthcare providers. Our hospitals, our federally qualified health centers, our outpatient clinics have all been calling and making appointments for their oldest, highest risk patients. So those people are not needing to, sort of fight the internet, not needing to, try to figure out how to get in. Providers are reaching out to them, and that really is our best practice. Okay, Instructor Caldwell on Facebook. So I would have to take a COVID-19 vaccine and a flu vaccine now. Will that weaken my immune system? No. So COVID-19 vaccine protects you from COVID-19, and the flu vaccine protects you from influenza. Those are not related in any way. There's no interaction between them. And importantly, neither of them weakens the immune system in any way. The way vaccines work, whether it's the flu vaccine or the COVID vaccine, they teach your immune system how to recognize an invader. They teach it how to recognize influenza or how to recognize COVID-19 or how to recognize measles, any of the things we vaccinate, and teaches the immune system how to fight it off without actually making you sick. So vaccines, it's not that they strengthen or weaken the immune system, they teach the immune system how to respond to help protect you against COVID. So yes, the recommendation is that you should get that flu vaccine annually, and the recommendation is that you should get the COVID-19 vaccine, both doses of it, when it is available to you. Okay. At Reese Sharon from Facebook, I had anesthesia last Wednesday for colonoscopy. Is it okay to go ahead for COVID vaccine after anesthesia injection? Yes, absolutely. This may be a question about possible reactions after injections. If you've looked in detail where the recommendation is now, we've really not seen a point of concern around allergies for people with food allergies or environmental allergies or oral medication allergies, but we've asked people to really consult with their doctor or an allergy specialist if they've had a prior severe allergic reaction to an injected medication or to a vaccine, so that we can look at the components there. But no issues with getting COVID vaccine after anesthesia. Good question. Catherine Mock from Facebook. Why is there no plan to vaccinate CPS teachers and staff? And then she also says, so 50% of the people vaccinated so far are white. Tell me how this doesn't perpetuate inequality in our city. So two really good questions there, and let's take them one at a time because they're not connected. So let me say this so loud and clear. There is absolutely a plan to vaccinate CPS teachers and staff, just as there is a plan to vaccinate all of the other educators who are in phase 1B. There are literally more than 3,700 CPS employees who have already been scheduled, been offered the ability to sign up and schedule their vaccine appointments. And we are allocating vaccine every single week to CPS teachers, just as we will be to the private and parochial schools, just as we've been allocating to the first responders and the corrections, and then further down the line, we'll be getting the transit workers, we'll be, there's the groceries, all of these groups. There is a plan, it is underway, and I'm not sure why, I know there's been a lot of political conversation about this, but I couldn't, people, of course we want to get teachers vaccinated, and they're a major part of the plan here. I think what the conversation has been is that, particularly with the amount of vaccine we're receiving, it's just that it is going to take many weeks to months, depending how long, how quickly our vaccine supply ramps up, to be able to get all of the CPS employees, just as it will to get all the other essential employees. There are more than 142,000 people who work in education in this city. Again, we're only getting 5,700 doses every day to go across all of the settings. And so there is a stream dedicated dedicated to CPS, just as there is a stream dedicated to all of the other large employers that are in 1B. So thanks for that question. And then on the second part, so 50% of the people vaccinated so far are white, and that does perpetuate inequality in our city. This is exactly why, as we move into 1B, let's think back a second. In 1A, who was eligible to be vaccinated? Healthcare workers and people living in long-term care facilities. And what we have seen is that, first of all, healthcare workers broadly may not reflect the population in terms of race and ethnicity. We also saw that there are a lot of suburban healthcare workers who come in and work in Chicago, right? Approximately, depending on the week, 37 to 40% of the vaccinating that we've been doing here in Chicago has been vaccinating non-Chicago residents who live here. We also know, and again, I would refer you, if you look online under the vaccination data, the second thing down that you'll see is about the preliminary survey results, like professional surveying that we did before vaccine was out, that showed, understandably, based on history, many fewer Black and Latinx Chicagoans saying, I am very likely to get the vaccine right off the bat. And so we've also seen a lot more hesitancy among Black and Latinx healthcare workers right away in 1A. The good news is that many people, now that millions, we're giving about 1 million doses of COVID vaccine every day across the US. And there are many, many health workers that have been now saying, I've seen a lot of my colleagues get both of their doses, they're doing well. More people really signing on to get vaccine, and we want to see that. But the whole point of Protect Chicago Plus is to direct vaccine to the parts of the city that are not seeing, that we've not seen as high COVID vaccination rates to date. And I'm not going to take all the time to describe it. If you want to, I think both last Tuesday and Thursday, we explained in a lot of detail here on Facebook about what, how we develop those community rankings, how we're focused on these 15 community areas, what some of that looks like, and I can ask more questions. But if you don't put an equity lens, if you purely have an employment-based lens, this is the outcome that you will see. Now that we're on 1B, we have the ability to over-enroll providers in the parts of the city where we most want to get vaccine. We've been working to push vaccine to providers that may see a lot of Black and Latinx patients, for example, encouraging them to bring in their patients. We're able to direct vaccine to higher risk settings, to senior living centers, to these homeless shelters, et cetera. And make sure that, particularly in communities where we're seeing less uptake, we're really making that available. And then at the heart of Protect Chicago Plus, this is really sort of the door-to-door. Let's get you signed up for a vaccine, and then let's bring vaccine to these communities in a way that is only available for folks in those communities. Our goal is to get to a point where some of the areas that are lagging behind are, this is equitable, are at or above the city rate for vaccinating. But what we see in that data is exactly what a strategy that is only based on employment, which is what 1A really was and had to be, in terms of the federal level. So I'm excited. This is where we're highlighting that already in just 1 week, seen some nice increases in that. Long way to go, but confidence building. Thank you to everybody who has been choosing to get that vaccine, really telling that story publicly, no matter your race or your ethnicity, no matter your background. I think when you are able to get vaccine, sharing that on social media, talking to people that you see every day about why you make that decision, is going to be really important. So thanks for that. Barbara Sherman on Facebook. When will the vaccine be available in the doctor's office? So it depends a little bit on whether so first of all, is your doctor's office in Chicago? So if your doctor's office is in Chicago, we have encouraged all doctor's offices to enroll to be vaccine providers. And there's one of the main tabs on the vaccine is for healthcare providers, and we've gotten many of them already enrolled. You should ask your provider if they're going to be a vaccine provider, because we would like every facility to have the ability to be a vaccine provider. We also have some of the hospital networks where there are providers that are connected with them. They've been working to help get providers enrolled, and like I said, the health department has been doing a lot of outreach, particularly in parts of the city where we don't have as many clinics and health providers, reaching out saying, how can we support you getting enrolled? So there already are a vaccine in a lot of doctors' offices, and more to come. Kelsey Johnson from Facebook. I'm a resident of Florida, but I live in Chicago for grad school and I'm trapped here. Where do I get vaccinated? And then, is Cook County Jail receiving vaccines and in what phase? Okay, so again, 2 questions not related to each other. So if you are living here in Chicago, even if it is temporary, you absolutely may be vaccinated in Chicago. That's not a problem. The question will be, when are you eligible for vaccine? So I don't know how old you are. If you are over 65 right now, if you are in grad school and also perhaps working in a manufacturing setting or a grocery store or a setting that would be in 1B, you would be eligible now. But in terms of where you can get vaccinated, if you're in grad school here, absolutely you can get vaccinated here. Really, we want our sites open to people who live, work, or get ongoing medical care in Chicago. We have had examples of people coming in to get vaccinated who don't live, work, or get ongoing medical care in Chicago. We can't always stop that because we've also made a decision not to require identification, but we have put in place the ability to really have people be attesting that this is them, that they live, work, or get ongoing medical care in Chicago. And then, is Cook County Jail receiving vaccines and in what phase? Yes. So Cook County Jail began, and again, this is a site that's been a major source of COVID outbreak for us. So where we're thinking about decreasing the risk, variants on the horizon, all of this, we definitely want to get vaccine into that setting. So we started in 1A with the healthcare workers who worked in Cook County Jail. We've been working in partnership with Cook County Health, providing vaccine. And started with the healthcare workers, and we are now working on the correctional officers and the other people who are interfacing with detainees in that jail setting. And then we will also be rolling into the detainees that are in that setting. We had to work to make sure that this was coordinated, particularly related to second dose, because we had to make sure, for example, say somebody is detained at Cook County Jail and then is convicted and moves into the state prison system, that they're going to get the right second dose in terms of the right type of vaccine. So there's been a lot of coordination there, and all of this is complicated by needing to do 2 doses. But yeah, we're already at working on staff, and then we'll be rolling in as vaccine is available to detainees. Tiffany Hagstrom from Facebook. Does CDPH still monitor the R0 number? If so, where can I find it? Oh, great question. We do. And we do this in conjunction with a number of the modeling groups around Chicago. If it's not up there right now, we can definitely post a link. Right now, we're sitting between about a 0.8 and a 0.9, depending on the day, which is good. As a reminder, it's technically RT. R0 is in a vacuum. RT is at a given point in time. But the bottom line is it's on average, every one person with COVID, how many other people are they transmitting to? And so if you have an R of 1, your outbreak is flat, meaning every one person with COVID is transmitting to an average of 1 other person. If your outbreak is growing, like it was during our second surge, on average, every one person with COVID is transmitting to more than one other person on average. And even if that's 1.1 or 1.2, meaning most people are going to 1, but some people are going to 2, that means a growing outbreak. And we are clearly continuing to be on the decline, which means that we are below 1. On average, every one person with COVID, most people are actually not transmitting to anybody at all. It's a good reminder, actually, that when we are doing the things that we know work around COVID, this is not generally different from measles again, not a disease broadly that we see usually one person, transmitting to a lot of other people, particularly with good mitigation in place. But yeah, we'll I know it's in there, but they've been redoing the website and trying to make things easier to find, and we absolutely do follow it behind the scenes. And if people are interested, I always want to make more data available. Wrinkle Nancy from Twitter. Are college teachers and staff in phase 1C or phase 2? I've been hearing conflicting information. So we are following the federal and the state guidance on that. My belief is that they are in phase 1C. Let me double check that for you though, just to be certain. I don't have it right in front of me, but it would be consistent with what is being done at the state and the federal level, and we will follow up. I'll take that as a marker to come back next week, just to be clear about that one way or the other. And again, 1B includes the daycare, the K through 12, really the settings that we're working so hard to make sure kids can be back in school, and the higher education are in the later phase. So we'll get back to you with the definite on that, but it's the same as what the state has. Petty Graph from Facebook. I was able to get an appointment for my 95-year-old mom. It's going to be Pfizer. Do you foresee any complications for her age? No, I really don't. We have seen, in fact, that even in the trials, the older people were even less likely to have side effects from the vaccine. And probably this is related to the fact that as people get older, their immune systems sometimes are actually not quite as robust. It's why we've seen people who are 95 plus have such severe outcomes from COVID. And so in the same way that their immune system may not fight off real COVID as well, from the vaccine on the plus side, they're actually less likely to have the side effects. But the good news is just as likely to have that same excellent level of protection. So Pfizer or Moderna, even in our very oldest Chicagoans, it works very well. The safety profile is great, and the efficacy profile is also great. We didn't see a difference there across age, and in fact, older people less likely to have some of those side effects. And again, the side effects are not dangerous if people do get them. They are just your immune system learning how to fight off COVID. It's not, you cannot get COVID from a vaccine. There is no COVID virus in that vaccine, but some people do have a day or two. When I got vaccinated, first dose, second dose, I actually didn't have any side effects. Maybe a little bit of a sore arm if I pushed on it. Honestly, nothing else. But some people, have had some more side effects. So glad your mom is getting vaccinated. People who are over 95 are who I am the most interested in getting vaccinated. So that's great. Andrew Samarco from Facebook. If my chances of being hospitalized from COVID are less than 1% as a healthy 28-year-old male, and science has shown with one dose it can give me 80% protection, why do I need 2 doses? Wouldn't it be better to utilize that shot for someone else that may need it sooner? Okay, so interesting question. Let me just correct one piece in it, but then speak to the larger question. So 1 dose actually does not give 80% protection. The Pfizer vaccine was about 52% protection. The Moderna vaccine was, I think, 49% protective. Basically about half protection is what you have after that first dose, and it's really after that second dose that it's the 95% protective. You may be thinking about the Johnson & Johnson vaccine, which we're excited about because some of that first data has been made public, and we do anticipate them putting a request in for the FDA. That's the single dose of vaccine, and that's the one that had about a 78% efficacy after a single dose. And so, there's actually been some thought about whether that single dose vaccine might be most appropriate for, healthy 28-year-old males, for example. Jury is still very much out on that. We need to wait for the FDA to do all of the review. We need to wait for the CDC to make that recommendation. But I do think, particularly as we think about younger Chicagoans, it is possible down the line that could be a group that we would use a one-dose regimen in, but very clearly, right now, the only vaccines that we have available, Pfizer and Moderna, both are authorized and recommended for a 2-dose regimen. So That is how the trials are done. That is how the safety and the efficacy has been done. And I don't want people thinking, let me save that second dose for others. We want you to get that second dose on time. But I think it is one of the interesting questions sort of looking ahead. Certainly something there's been a lot of conversation in the public health community about. So really good question. Marianne Hidalgo on Facebook. Is the needle long? My arm is slim, not much flesh. No, the needle is not particularly long. I've actually given a good number of these at this point. And really universally, people say I didn't feel a thing. Like that didn't hurt. We even have the ability, you can use different sizes of needles, should that be necessary for different arms. But this is not broadly the actual vaccine itself. In my own experience, but also, talking to nurses and other, we're not seeing complaints right at the time of administration. Again, for some people, 24 to 48 hours later, they'll have some pain afterwards, et cetera. But no concerns about your arm being, too small or the needle being too long. That one I would totally put out of concern. Okay, so we are at 5 minutes left, so I think I'm going to go ahead and wrap up. Again, if we didn't get to your question today, we will get to it later, or work to get it on Facebook. So thank you, everybody. In terms of some good news, so again, press conference today at 1 o'clock. We will be sharing some, I think, pretty exciting news about some more technology advancements that we're making here in Chicago related to vaccine, and I encourage you to tune in for that. And then one really exciting update, not related to COVID, is that throughout all of this, the Chicago Department of Public Health has not stopped working on mental health issues, substance use issues, behavioral health issues broadly. And we announced the opening of a really beautiful new space for our Lawndale Mental Health Center in the 28th Ward. We've been working with the Department of Assets, Information, and Services to substantially renovate 3 of our 5 mental health clinics, and we're getting the rest renovated this year. Obviously, COVID has really brought to light something that we've known for a long time, but I think everybody's been talking about mental health needs even more. And we've been really excited to make really physical investments and, be able to open that new office space. It's really beautiful. Continuing, even though a lot of our appointments right now are being done virtually, working still to make sure that that physical space, continues to improve and be welcoming, so that particularly as we start to come out of COVID, we really see this as, a trauma-informed transformation is how we think of it. How to make spaces that are more welcoming, less likely to, evoke memories of trauma, things like that. So that's exciting, and we posted some things about that on social media and online too, if you want to read more about that. But lots of good work happening in the mental health space, and it's an example of a space that we want to really continue to build and have seen such increased needs for, particularly among younger Chicagoans, and doing a lot of work there. So with that, thank you for tuning in. We'll see you at the press conference at 1. We'll be back on Thursday. I think I will be with Sybil Madison again then. Happy to take your questions. And until then, please do be safe, keep doing the things you know work, and let us know if you've got other questions. Bye-bye.